I'm Dr. Dan McKeska. I'm going to be discussing what medical fitness is. I'm also going to provide some insights from my 25 years of experience in the medical fitness space. But before I get started, I want to give a quick shout out to MedFit Education Foundation for sponsoring this presentation. Thank you very much. I was told years ago by world-renowned pediatric cardiologist David Son, he never gave a speech without or a presentation without notes because he would get too far off track. And that's me. I have to use notes. My mouth often engages before my brain, so please forgive me if I do refer to my notes, as we're going to go over a lot of information in a fairly short amount of time. A couple things, though, before I get started on the main feature. Two things have come up in the past few months that I found interesting. One is a study that was printed in the Journal of Science. Researchers examined males and females from 8 days to 95 years old to determine how age affects metabolism. And their findings suggest that during the first year of life, metabolism is fastest during the first year of life, decreases until about age 20, and then plateaus until about age 60. So in theory, a 55-year-old has the same metabolism as a 25-year-old, and accordingly will burn the same number of calories, given the same level of activity. This would completely negate the metabolism is slowing down excuse and suggest that weight gain later in life may be due more to lifestyle rather than the actual act of aging. I'm not sure of all the implications of this yet, but it will be interesting to see where the various avenues of research go based on these findings. The next actually has to do with kids and COVID. It appears kids in the UK do not have the same severity of symptoms that kids in the US do. A recent study analyzed 915 COVID cases among children and teenagers in the US. 78% were hospitalized because of complications of COVID-19, with almost 50% in respiratory distress, and close to 75% of those children were placed in intensive care. Right now, the prevailing theory is kids in the US are more obese and more sedentary than kids in the UK and other industrialized nations. Again, I'm not exactly sure of the implications of all of this, but it's going to be interesting to see where this leads and what, if any, policy changes are made regarding children and activity. But for now, this is actually a perfect segue to discuss COVID-19 and chronic disease. I think based on the audience, particularly in the age of COVID, and the fact that it appears it is here to stay, we can all agree this is a fairly serious issue. Recently, I've been doing some research and I found out that almost 25% of COVID patients have also been diagnosed with cardiovascular complications, contributing to almost 40% of all COVID deaths. Many COVID patients have been diagnosed with mild inflammation of the heart muscles, which should concern patients with comorbidities that lead to or cause systemic inflammation. There's also evidence suggesting patients who have uncontrolled or untreated hypertension also have a very high risk for becoming severely ill with COVID and developing disease-related complications. And for our obese clients, it's now known the risk of developing severe disease from COVID-19 increases as BMI increases. And people with a BMI of 45 or higher have a 100% greater chance of requiring mechanical ventilation and a 61% greater chance of death when compared to people with a healthy BMI. We all understand the benefits of exercise, and based on this info, I think it's clear that exercise has literally been a lifesaver during the past 2 years, and that fitness really is the front line of medicine. So enough about the present. Let's delve into the past for a few minutes. I didn't start out in fitness. I actually started out as a martial art instructor, which I still enjoy today. But when looking at the demographics, martial arts students are 18 to 34-year-old males. I mean, you can see how young I am here. They're just starting out in life, new jobs, new homes, new families, etc. Versus medical fitness clients, who are usually well established and realize that they've been sitting for too long, never took care of that old college injury, or just saw their doctor and found out that they're pre-diabetic, hypertensive, overweight, whatever it might be. As a business move for me, it was a good one, and I started networking with physicians, chiropractors, and physical therapists. The ones who knew me referred their patients. The ones who did not know me wanted to know why and how I was qualified to help their patients. When you think about it, that's actually that's a pretty good question. Considering to be called a personal trainer in the US, All it takes in most areas is to hang a sign on your front door or in the window advertising personal training. So to level the playing field, I went back to school. And during this time, I found out there is a lack of credible educational opportunities for fitness professionals who want to work with clients with one or more chronic disease. And that's not to say there aren't certifications out there, but the ones I looked into were heavy on the medical side and very light on the fitness side, or relied on a facility having expensive equipment versus what most trainers have access to, or in some cases, if they required a college degree, they did not accept online degrees, which left me out. So understanding I could not be the only one in this situation or who thought about this dilemma, when I graduated with my doctorate, I developed the medical fitness course. If we were in person right now, I would ask everyone who has clients with chronic disease to raise your hand or stand up or do push-ups or jumping jacks, something, pick something. Instead, just ask yourself, how many of my clients do I have that have one or more chronic disease? Because of the deleterious effects of chronic disease and the importance of regular exercise, prior to COVID, over 8 million people were using the services of a personal trainer. Did you know by offering personal training services, you are implying that you have the knowledge, skills, and ability to provide a safe workout? Unfortunately, a basic personal training certification suggests the holder is qualified to only work with apparently healthy individuals. Realistically, though, excuse me, when the overweight and obesity rate is close to 70%, more than 100 million Americans have high blood pressure, and over 10% of the US population has diabetes, more than likely, you are already working with a client who has a chronic disease. So it's not surprising in one recent survey, a large percentage of personal trainers indicated they have worked outside their scope of practice with clients who had one or more chronic conditions. If a personal trainer provides orthopedic diagnostic and rehab services to the client who comes in with a sore shoulder from golf or tennis, if you provide nutritional advice to the client who wants to get their summer beach body, or if you massage a client who complains of tight hamstrings or traps, without relevant training that provides a course of study and a comprehensive exam, you are most likely working outside of your scope of practice. Because fitness is the front line of healthcare, there is a need for qualified fitness professionals who know how exercise affects clients with one or more chronic disease. So let's take a look at chronic disease for a few minutes. Chronic disease is a disease that progresses slowly, lasts for a year or more, requires ongoing medical care, and interferes with activities of daily living, versus acute disease, which comes about and dissipates quickly. And here's a list of some common chronic conditions that you may come across. And as you can see, it is fairly extensive. Most chronic diseases are caused by a few risk behaviors, such as smoking, poor nutrition, excessive alcohol consumption, and a lack of physical activity. Whereas historically, infection was a leading cause of death in the United States, today most people will die from chronic disease. And think about this. Since the Industrial Revolution, most adults in industrialized nations have decreased their number of steps by an estimated 70% a day. Time in front of the television or non-work screen time has increased by 1% per year for the past 50 years to a current median screen time of over 4 hours per day. That's non-work. Add work into that, and it's obviously a lot more. More screen time, oh, and don't count webinars either, we're good. More screen time is associated with lower psychological well-being, less curiosity, lower self-control, more easily distracted, more difficulty making friends, less emotional stability, being more difficult to care for, and an inability to finish tasks. The average adult spends 1 to 5% of each day performing moderate to vigorous activity. 80 to 90% of adults aged 18 to 65 do not meet the recommendations for aerobic and muscle strengthening exercises. And I think you're going to find the following statistics fairly alarming. Chronic disease accounts for almost 70% of all deaths in the United States. At least 50%, maybe as many as 60% of the adult US population has at least one chronic disease. More alarming, up to 40%, 25 to 40% of the adult population has 2 or more chronic diseases. Type 2 diabetes affects over 30 million adults in the US and is expected to increase to more than 330 million adults worldwide in the next few years. Almost 40% of the US adults are considered obese. The most prevalent chronic disease is cardiovascular disease, which is responsible for almost 18 million deaths annually and 31% of deaths worldwide. Hypertension affects over 100 million US adults. I think it's about 130 million now. In the United States, it's thought that everyone over the age of 60, that's almost 70 million people, has at least one joint affected by osteoarthritis. Almost 2 million people in the US are diagnosed with cancer annually, and over 600,000 die from it, making it the second leading cause of death. And the prevalence of asthma has increased over the past few decades to just under 10% of the US population. And as I mentioned earlier, in today's world, we have to think about COVID-19. Anyone at any age with cancer, chronic kidney disease, COPD, cardiovascular disease, a weakened immune system, anyone who is obese, has type 2 diabetes, and obviously the list goes on and on. They all have a greater risk for developing severe complications from COVID-19. Yet, we know physical activity can positively affect over 30 chronic conditions. It's the #1 deterrent of chronic disease in primary and secondary prevention. Yet only 15 to 20% of US adults meet the minimum guidelines for physical activity. Similarly, 1/3 of the world's population does not perform the recommended amount of daily activity, making it the biggest public health threats of modern time. That's over 2.5 billion people who do not meet that number. Physical inactivity is activity at a level less than what is required for optimal health and is considered a cause of chronic disease and premature death. And the deleterious effects of inactivity are progressive and compounding, resulting in a worsening state of disease and/or dysfunction. Cardiovascular disease, muscular atrophy, hypertension, lipid disorders, osteoporosis will all deteriorate. Diabetes will all deteriorate with prolonged periods of inactivity. So now we actually come to the root of the problem in the US. It's the healthcare continuum. The current model of healthcare in the US is based on treatment rather than prevention. Treatment is given for a disease or injury that has been diagnosed, whereas prevention is taking measures to avoid or improve a probable or possible disease or injury. It's reactive versus proactive. Prevention is categorized as primary, secondary, or tertiary. The goal of primary prevention is to stop a condition before it starts and includes immunizations, targeted types of exercise, and wellness programs and education. Secondary prevention interrupts the progression of disease in hopes of slowing down or reversing the progression and includes examples of treatment for hypertension, asthma, some cancer treatments. The goal of tertiary prevention is to manage and treat symptomatic disease in the hopes of reducing the severity, restoring function, and reducing disease-related complications. And it includes measures such as treatment for late-stage cancer, emphysema, and some forms of orthopedic rehab. The #1 deterrent of chronic disease is physical activity for primary and secondary prevention. Therefore, the main goal of medical fitness in the healthcare continuum is to prevent the onset of chronic disease. And we can take our clients from functional to healthy to fit, and if they want to, performance. I often explain this in terms of a line. One end of the line is dysfunctional, the other end is healthy. Traditional medical intervention takes your client to 0, meaning they can cook and use a restroom basically. Our goal is to get the client well past 0, so there's room for a misstep. And when an injury or disease does occur, there's money in the health bank and the effects do not take the client below 0 again. They're no longer living paycheck to paycheck with their health. Medical fitness helps bridge the gap between clinical intervention and conventional fitness programs. A medical fitness specialist can work with clients and groups who are at risk for chronic disease, have health conditions that may be mitigated or managed by exercise and activity, and are newly diagnosed with disease or need exercise guidance. Maybe they've completed a medically supervised rehab program such as cardiovascular, orthopedic, and need to continue progress. The role of a medical fitness specialist is to work with the client's team of other healthcare providers rather than working outside of our scope of practice and trying to correct all of the issues on our own. Building this medical network and the willingness to refer clients to another better qualified provider indicates that you as a fitness professional, your main goal is actually the well-being of the client. And the team of providers may include a nutritionist or dietitian, physical therapist, a mind-body specialist such as Tai Chi or yoga or Pilates, an alternative healthcare provider such as a massage therapist, chiropractor, and recently, since the beginning of the pandemic, I now also recommend having a mental health specialist in your network. Regardless of all of this, the client's referring physician, maybe primary care, cardiologist, oncologist, orthopedist, whatever. The physician is the center of the client's healthcare team and should be provided regular updates as to the client's progress. My absolute favorite quote is by a guy who lived over 2,000 years ago. Hippocrates suggested illness was caused in part by a lack of exercise. The healthcare continuum as an integrated system of care that guides and tracks patients over time through a comprehensive array of health services spanning all levels of intensity of care has been largely ignored in most industrialized nations, as evidenced by the prevalence of preventable chronic disease. Even though exercise is an effective treatment for many chronic conditions, physicians often fail to promote activity as a means to prevent and or treat chronic disease. In fact, only 1 in 3 adults is advised by their physician to increase physical activity. And this can be due to a lack of training at the undergraduate or graduate level, but also many physicians themselves do not meet the recommended level of physical activity. And unfortunately, the best advocates for exercise are those who believe in its effectiveness and importance. Because of its ability to prevent and manage chronic disease, medical fitness, particularly as primary prevention, should be used to the same or greater extent as other prevention strategies, such as prescription medications. But who should be doing this? Who should be taking on this? Because of their credibility, physicians are well positioned to promote medical fitness. It's known patients who receive prescriptive exercise and a community referral from a primary care physician are more likely to achieve a moderate level of activity for the recommended 90 to 150 minutes per week versus patients who just receive usual care. So one thought is training physicians to become fitness experts. It may encourage them to prescribe and oversee physical activity. But given the demands and constraints on medical school curricula and a physician's time, a more prudent approach is to educate fitness professionals in the prevention and management of chronic disease through medical fitness programs. As mentioned, because of a lack of education in exercise prescription and programming, only a small percentage of physicians are actually confident designing an exercise plan. In contrast, kinesiologists and exercise physiologists, us, we're specialists who study human movement and its effect on quality of life. Accordingly, fitness professionals who are educated in exercise programming and the effects of chronic disease are better prepared to implement medical fitness programs. But physicians do not feel confident referring their patients to a trainer. A physician has at least a minimum of a decade of education, and many personal trainers have only a weekend certification. Some places offer a day certification. In some cases, they don't have any at all. A physician is a licensed healthcare provider who had to pass a board exam and is regulated by a state health department. Personal training has very little oversight and is largely self-regulated. Many personal trainers work outside their scope of practice and beyond their level of education, placing their clients and business at risk. Physicians who are already prime targets for a lawsuit are hesitant to network with a trainer who does not possess the knowledge, skills, and abilities as proven by a credible course of study and a comprehensive exam. So right about now, you might be thinking, this is all good stuff. How do I fit this into my practice? How do I start? Who do I call? So if you look at any social media group, you will see these are the exact same questions that are asked time and time again. I honestly wish I had all of the answers. What I can tell you, and what I'm going to tell you now, is how I had a successful training business for almost 25 years and what worked for me. If you're just starting, I really suggest you work in a big box gym, at least for a little while. Unfortunately, it's probably not going to pay much, but you're going to learn so many things that you really can't put a price on, such as your local market, because every market in the country is different. You'll learn how to sell and market your services, and you'll learn what the market will bear as far as pricing goes. And Someone else will be paying you while you're doing this learning, the gym, the big box gym. Always use someone else's money when you can. More importantly, you'll discover what you want to specialize in. Yes, specialize. Does not mean ignore the other aspects of training, but specialists make the most money per session. And this next step is going to make all of the introverts in the crowd cringe. Start networking in a gym. Introduce yourself to everyone who walks in the door. Don't try to tell them how awesome you are. You're going to have plenty of time for that later. Just tell them who you are. Let them get to know you first. Get to know them. Find out what their goals are, what type of work they do. Are they married? Do they have children? Do they like to go out dancing every weekend or play pickleball? In this instance, information is power. If they have a desk job, it's likely they've developed an imbalance from sitting for too long. Do they walk to work, drive, take public transportation, ride a bike? If they're married, will their significant other be okay with hiring a trainer and spending the money? Do they have children who they want to be able to keep up with? Or their grandkids? Do they do their own yard work or fix up stuff around the house? Get to know them. That way, when you see them incorrectly doing a movement and you ask them if they want to learn a more effective way to hit that muscle group or fix a certain imbalance, you're not going to sound like a gym rat on the prowl, okay? It's a great way, one great way to connect with a lot of members in a very short amount of time is to teach group fitness. With your knowledge of fitness protocols, you can teach a boot camp class or you can make up a class. Okay, don't laugh at me. Don't laugh at the styling I'm pulling off here. I used to teach a class called Stretching, Strength, and Stamina. I know, it's totally styling. That was over 20 years ago, but I still train one of the clients I got from teaching that class. I moved since then. She still works with me virtually. Use your imagination. You can also teach a few seminars. I used to teach a few self-defense seminars every few months. I simply posted flyers around the gym. But because I don't like to give away anything for free, I used to charge, I think, maybe 10 bucks for a 2-hour seminar. Yes, I used to be able to kick like that. I haven't done that in a long time. I'd probably, I don't know, break something. One thing I know each of you can do is offer a discount for assessment and movement screens. Use a sign-up sheet with spaced out times and advertise a certain time around the gym. Assessments are your single best selling tool. If you're already established, have a good base of clients and want to add medical fitness to your practice, the same advice applies. Network. I spent years paying for ads, AdWords, Thumbtack, local newspapers, etc. If you think advertising is a good use of your budget dollars, type fitness trainers and your city or town into Google and see the returns. I live in Myrtle Beach, and this is what came up for my city. Just under 12 million results in less than a second. And unless you want to pay top dollar, excuse me, for Google AdWords, chances are you're not going to be at the top of the page. And actually, because many trainers have switched to virtual training, allowing for a worldwide reach, getting listed at the top of the page is even now more expensive. I know a few people who have had relatively good luck and great luck actually using Thumbtack. But this is a return from Thumbtack in my area. Notice it in the corner. It indicates there are over 100 fitness professionals in my area. Unless there's something that stands out in my ad or I drastically reduce my rates, Thumbtack, AdWords, they were not the best options for me. Mostly because prospects are not going to know anything about your certifications or education and what makes you different. All they're going to look at is price. Ask yourself, have you ever seen an ad for a doctor or physical therapist? Not their company or hospital affiliations, but them personally. We as fitness professionals know the significance of the various certifying organizations, what we had to do to earn each and every certificate we have. But prospects don't know, they usually don't care. What they care about is money and who is the least expensive trainer they can find. I found the clients who are looking for a deal are not the ones who will stick with it long term. It's just not a priority for them. However, if they are from a referral, money becomes secondary and feeling better becomes primary. Your time is going to be better spent networking with medical professionals. We've already discussed that medical professionals have perceived credibility, and patients who received prescriptive exercise and community referral from a primary care physician increased their level of physical activity. I recently had an MRI and the radiologist and I started talking about what I did. Before I left, he asked me for my contact info and indicated he wanted to pass it along to some of his colleagues. Maybe I'll get a client or two, maybe I won't, but talking to him cost me nothing and the rewards could be exponential down the road. From my own experience in my own business, I found chiropractors, physical therapists, and massage therapists to be the best source of referrals. And the most efficient way to network with them was to go through my clients or other people I knew. Ask your clients for a personal introduction or to drop off a letter of introduction. Have brochures printed. Keeping in mind, medical networking materials should be different than the materials used for your clients. Worst case, set up an appointment for yourself, get an adjustment or a massage, tell them what you do. Regardless of what happens, by the end of the time spent with them, your trigger points will be released and you'll have had a good adjustment or something. The thought with a referral network is the same as advertising. Why should they use your services? Why should they send their patients to you? Whereas a client might like something edgy, something that an up-and-coming entrepreneur would use, a medical professional, their reputation is on the line. And more important than being able to help their patient is knowing that you will be with their patient every step of the way and you're not going to hurt their patient. You should provide info on your education and certifications and how all of this will help with their patients. An example of an elevator speech might be something like, excuse me, my allergies are getting to me today and I apologize. I earned the medical fitness specialty certification from MedFit Classroom. The medical fitness specialist course is for health, fitness, and exercise professionals who are on the front line of healthcare and aid in the management and prevention of chronic disease. We know exercise and physical activity can positively affect over 30 chronic conditions, making it the #1 deterrent of chronic disease in primary and secondary prevention. Accordingly, I have knowledge of exercise program design and management for over 35 chronic conditions, and in collaboration with clinicians such as yourself, I'm in a prime position to help your patients prevent or ease the burden of their chronic disease. I've said that a number of times in the past, or various parts of that. You also need to determine what type of client you want to train. I know a trainer who has a thriving business training student athletes. As part of his business, he's networked with orthopedists who work on young athletes, and together they help these young athletes recover from various orthopedic injuries. We have a section on orthopedic dysfunctions that can help with that. Maybe you have an older client who suffers from arthritis or osteoporosis. The medical fitness specialist program has info that can help you. Or if you're like most other trainers, you already have clients who are overweight, obese, have hypertension, and maybe type 2 diabetes. The medical fitness specialist has programs for that. We also have sections on cardiovascular, metabolic, and pulmonary diseases. And every section has easy to reference lists and charts. There are two more things that I want to touch on really quickly. Both of these topics come up a lot in some of the exercise fitness forums I read. The first is the assessment. We all know the static postural assessment, the overhead squat assessment, the FMS, pushing pulling assessment, whatever. They all provide a ton of info on dysfunction. What's often overlooked is the idea that each assessment is also an incredible selling tool. It's probably the best selling tool there is. This is the opportunity where a prospect is putting their trust in you for the first time. They are expecting something, not just a discussion on how you can help. Talk is cheap. You need to show them how you can help. What dysfunction stood out the most? I cannot say it in any clearer terms. Exploit their weakness. Show to them that you will turn that weakness into a strength. So for example, let's say someone's knees. I think 95% of all my clients have issues with their knees. Maybe they adduct, maybe they abduct, maybe they're just not stable. So let's say the knees adduct, adduct. Based on experience, and this is also in the medical fitness specialist program, I know this is caused by tight overactive adductor complex, short head of the biceps femoris, TFL lateral gastroc, or vastus lateralis, or underactive medial hamstrings, medial gastroc glutes, or vastus medialis. I also know that corrective flexibility exercises that may help are lateral lunges, sit and reach, iron cross, terminal knee extensions, and the standing TFL stretch. Strengthening exercises should include lateral tube walk, seated straight leg raise, ball squat with abduction, and ball bridge with abduction. Pick one or two of these exercises for this client to perform. If you did the assessment correctly, the client will not be able to perform these very well, and they'll know it. Honestly, they're going to feel awkward or off balance or inadequate or just plain weak. I hate to say it, that's your selling point. You just proved to the prospect that in a very short amount of time, you were able to determine a dysfunction and offer solutions on how to correct it, and also how to challenge your new client. Unfortunately, not all clients will be able to perform a full assessment due to disability or dysfunction. In this case, start with static posture or upper or lower cross syndrome, and work on the associated corrections. Maybe start with balance drills that correct a faulty gait. There's always a dysfunction. Everybody has repetitive movements or lack of movement that create an imbalance. As I said, your job is to find it and exploit it. Lastly, I haven't mentioned this, you'll hear it time and time again from me. I do not like to give anything away for free. This places your value at zero, and many of us have spent too much time and money to be worth zero. I hate to even discount anything, but every now and then, a specialized sale is effective. For one day only, this coming Saturday, get a complete movement screen for half price. Think about it. Does your doctor give away services for free? What about the folks who work on your car or Chipotle? Who do you know that gives away their services for free? We shouldn't either. To an outsider, it says, you're desperate and no one wants to go to a desperate business owner. Besides, honestly, it's almost never about the money, but rather priorities. Something in that person's life is more important than their health. And people looking for freebies are not going to stick it out for the long term because their health is at the bottom of the priority list. Chronic disease costs more than just money. It costs time, it costs productivity, and it costs lives. Up until now, very few organizations are trying to address this problem. Not physicians, not health departments, or even educational institutions. We know fitness is a real front line of healthcare. And as a medical fitness specialist, you will understand the effect of exercise and activity on health and chronic disease. You're going to know the role of a fitness professional in the healthcare continuum and recognize the signs and symptoms of common chronic disease. You will be on the front line of healthcare by aiding in the management and prevention of chronic disease. You can position yourself as an essential part of the healthcare and business community and expand your scope of practice to the largest, fastest growing demographic in the US. You'll gain credibility and be able to network with other healthcare providers. And to top it off, you will earn valuable continuing ed credits, as this course is approved by most of the certifying bodies. Lastly, you will increase income by expanding service offerings in an area that is much needed, but severely lacking qualified people. And the Medical Fitness Specialist Program is the best place to begin. This course is divided into 7 sections. The first few discuss scope of practice and rapport, various assessments that can be performed with minimal equipment, and fit protocols. Subsequent sections discuss cardiovascular disease and coronary heart disease and hypertension. And there's information on COPD and asthma. We have a section on metabolic diseases, metabolic syndrome and cancer, obesity, body composition. We also have sections that cover core, balance, and gait, low back pain, upper and lower extremity dysfunctions, as well as dysfunctions of the hips and knees. So because we have a little more time, a few more minutes, what I want to do is I want to give you an idea of what's covered in the Medical Fitness Specialist Program. So let's look at one of the most prevalent chronic diseases, hypertension. So this section, we're going to discover hypertension and the comorbidities, the prevalence, risk factors, characteristics of prehypertension and hypertension, current guidelines and recommendations. We're going to look at pharmacology, activity, precautions, contraindications, and a little bit on nutrition. So hypertension and prehypertension affect over 160 million US adults, nearly 1 billion people worldwide. That's 1/8 of the Earth's population. Hypertension is an independent risk factor for coronary artery disease, stroke, renal failure, heart failure, atrial fibrillation, valvular disease, sudden cardiac death, cardiomyopathy, and aortic aneurysms. And accordingly, the higher the blood pressure, the greater the risk for a cardiovascular event, kidney failure, or stroke. Hypertension is the most common chronic disease risk factor. Adults over the age of 50 have close to a 90% chance of developing hypertension. It's also the costliest risk factor for cardiovascular disease. Most importantly, it is the most preventable. So let's go back to the beginning. Cardiac cycle explains what happens when the heart beats. The systole phase, the top or higher number, the ventricles contract and pump blood into the vascular system. In the diastole phase, the bottom or lower number, the ventricles relax and the heart again fills with blood. Blood pressure is determined by cardiac output times total peripheral resistance. Cardiac output is the volume of blood pumped by the heart, and peripheral resistance is systemic vascular resistance, or the resistance that must be overcome to push blood through the circulatory system. Up until recently, hypertension was characterized by blood pressure of equal to or greater than 140/90, and pre-hypertension started at 120/80. Unfortunately, not many patients were taking their diagnosis of pre-hypertension seriously. So a few years ago, the metrics were changed on this. The new guidelines still consider below 120/80 as normal. 120 to 129/80 is considered elevated. 130 to 139/80 to 89 is now considered hypertension stage 1. HTN stage 2 is 140/90 or higher. And higher than 180/120 is considered a health crisis, and the client should seek immediate medical attention. Primary hypertension, sometimes referred to as essential or idiopathic hypertension, accounts for 95% of all hypertension cases, where the cause is unknown or there is no known secondary cause. Secondary hypertension has a known underlying cause and can be attributed to obesity, insulin resistance, high alcohol consumption, aging, sedentary lifestyle, stress, high sodium consumption, low dietary fiber, or lack of potassium and/or calcium. These health risks can be identified independently, but are usually found in combinations. It's important to know what medications a client has been prescribed, as many of the common medications used to treat hypertension do have side effects and do affect exercise performance. So as you can see, use mechanisms and side effects of common medications are listed here. I'll let you stare at that for a second before we go on to FIT guidelines for hypertension. I'll leave this up here for a minute. So, due to a reduction in peripheral vascular resistance, exercise training and a high level of fitness are associated with lower levels of hypertension. Makes sense. It's been estimated, though, for a 10% weight gain, there is a 6.5-point increase in systolic BP. For adults with hypertension, aerobic exercise training lowers blood pressure 5 to 7 points, while resistance training lowers blood pressure 2 to 3 points. Keep in mind, due to post-exercise hypotension, it's recommended clients with hypertension perform aerobic exercise on most days of the week with an intensity of 40 to 60% of their heart rate reserve, or an RPE of 11 to 13. Because of the deleterious effects of weight gain on BP, clients should work toward an expenditure of 2,000 calories a week with a focus on aerobic exercise. And because aerobic training lowers BP to a greater extent than resistance training should be used as an adjunct to aerobics and should be performed 2 to 3 days a week at an intensity of 60 to 80% of 1 rep max. Also a combination of, Also a combination of light weights and fast pace may provide better training effects. So high intensity interval training should also be considered, obviously with the physician's approval. And here's a list of some cautions and contraindications, and I'll leave this up here for a second so you can look it over. So in addition to what's listed here, keep in mind it's possible in clients with hypertension that an increase in arterial blood flow and blood pressure may dislodge arterial plaque, causing a stroke or a heart attack. Further, any existing endothelial damage, which is like the lining of your blood vessels, may be exacerbated. Because of a reduction in skin blood flow, clients with hypertension, HTN, may not be able to dissipate heat effectively, disrupting normal thermal regulation. Therefore, the exercise load needs to be carefully monitored, modified, or ended at the first sign of heat stress. Also keep in mind, beta blockers blunt the normal heart rate response, nullifying the recommendations of 40 to 60% heart rate reserve, and the RPE scale has to be used to gauge exercise intensity. Most importantly, a trainer should not work with clients who have uncontrolled hypertension. Everybody see that big stop sign? That's pretty important. So nutritional considerations, I'll leave this up here for a minute. Specific meal planning is actually the responsibility of a registered dietitian. However, nutrition basics can be discussed as they may affect some aspects of exercise, and this list provides general guidelines for clients who suffer from hypertension. Keep in mind, of course, that it is outside the scope of practice of a trainer to provide nutrition counseling. And just so you know, I did my due diligence. Yes, here are my references for the info on hypertension. So I hope this has been helpful. And for anyone who wants to learn more, you can pick up a copy of my textbook, Clinical Exercise Specialist Manual, a Fitness Professional's Guide to Training People with Chronic Disease, is available on Amazon. And I believe there's a 40% discount on the Medical Fitness Specialist program for the next few days. So thank you for your time. And I do think we have quite a little bit of time anyways for some questions. So let me exit out of here and quit sharing my screen.
Right, I will take that back. Thank you very much, Dan. That was fantastic. I appreciate that greatly. Q&A. Dan, first and foremost, thank you once again. That was fantastic.
Thanks
very
for having
informative. Me. Oh, you bet. You bet. You did a great job of, framing exactly what we're up against on a number of in a number of aspects, both from the perception of a fitness professional from the medical field and what they see in us and what they think of us. And a lot of it, I do believe that the fitness, historically, the fitness profession and the bodies that provide the certifications have done a poor job of positioning ourselves. For far too long, it's always been about aesthetics. It's been about looking good. It hasn't been about living a long, healthy life and implementing those factors in. It's always been about either fitting in the clothing or looking good in the beach in the summer, or being able to be strong enough to lift a car up over your head. It hasn't always been for health, which, as you said, it's the reason we're here. But we've got chronic disease, arthritis, you rattled them off, osteoporosis, obesity, diabetes, chronic, everything, hypertension, Alzheimer's, depression, all of these things. We know that exercise works. We know that it helps. Why is it lost on the medical field? I guess we'll start with them.
It's not lost on them. They know it as well as we do. The disparity comes when, for decades, we've thought that they should just refer their patients to us for help. But based on the lack of education of most fitness trainers, I'm aware that there was a recent gathering, a recent fitness conference where you could get certified in a day to be a personal trainer. What doctor, what physician that's had to go through med school, internship, residency, and think about it. Let's say we're talking about an orthopedist. An orthopedist then has to go through another, 5 to 10 years of surgical training before they can actually even operate on a person. Why would they send one of their patients to somebody that has 1 day of training? We've wanted them to come into our space. We need to be working to get into their space. And the way we do that is by learning their language. If you talk to a doctor and you're looking at an x-ray and you say, oh, that's the lateral side of the hip, and all of a sudden they realize, okay, this person knows lateral versus medial. Or, so if we strengthen these adductors, if we strengthen the adductor complex, this will hopefully pull that leg internally a little bit, medially a little bit. Oh, okay. All of a sudden the doctor looks at that trainer with a different set of eyes. They're not just a dumb trainer who drinks protein shakes and counts reps. They now know what they're talking about because we're now talking the medical language, and we don't have to learn all of it. We just have to learn how it fits into our space, but we have to communicate with them. And they need to be confident in sending their patients to us. We know we're not going to hurt them. How do they know we're not going to hurt them? That's what our battle is. We have to work. Again, it's been backwards for years. We've just expected them to do it. Question is, why should they?
I can't think of anything else, any other profession. I mean, whether it's automotive or sales or anything else where a weekend certification will do the trick. It doesn't make us skilled professionals at all. It checks a box, and it gives us an opportunity to call ourselves something that perhaps we're not qualified to do. Not even perhaps, we're not. It doesn't. And unfortunately, it puts a bad light on fitness professionals, health, medical fitness professionals. Really, let's call ourselves what we can be or what we are. Especially after this course. Scope of practice. Does your course enhance our scope of practice at all?
Dramatically.
Dramatically.
So what I've done with this course is I designed it from the perspective of a fitness trainer working in a fitness studio, because that was me. So I didn't have access to VO2 max testing equipment and all this other stuff, hydrostatic weighing. I didn't have any of this stuff. I had to, okay, how can I figure out what this person's cardio is? Well, we can do a 3-minute YMC 3-minute step test to evaluate their cardiovascular fitness.
Sure.
I mean, I have an 8-inch, 12-inch, 16-inch, 24-inch Plyo box. We could use that. And so I designed it from that perspective. Now with that, I also designed it looking at, with the medical people I knew, what did they ask me? What did they look for what I knew? And they wanted to know, did I know contraindications to whatever the chronic disease was? That was the first thing. Even more so than exercise protocols was contraindications. What should we not do with that person? They wanted to know that I knew that beta blockers blunted heart rate response. So we have to use the RPE scale, which is, by the way, there are studies out there that prove the RPE scale is a valid indicator of 2 lactic thresholds, or the first lactic threshold. So we know all this. So let's put it in an easy to use format that has tables, lists, the background of it. In other words, why is this important? This is, 160 million people are affected by hypertension. That's pretty important. Chances are, if you're a fitness trainer, you're dealing with someone that has hypertension. You may not know it, or maybe you do know it, but now you have, 10 pages of a book or a chapter of this program that you can go to, pull up all the information in a really easy to use format and do it. And when you take this course, you've now proven to other people that you've done that as well, that you've put in your due diligence, that you're not just guessing. You're not just saying, well, my lead trainer told me blah, 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 blah. Who cares? This is what you know now. Nobody can take that away from you. This is here.
Right. Yeah. So many, it's just sweat. Well, no, it can't be that way. And really, like you said, you get the playbook. You have the information in front of you, so you know how to implement the programming that's going to best suit their needs. And that's no different than when a doctor opens up his prescriptions and says, okay, this medicine is for you. This medicine doesn't work well with other medicines. We're again on a level that's very important. And you pointed out earlier, apparently healthy individuals is what that certification qualifies for us to do. Well, apparent isn't hypertension isn't always apparent. Diabetes isn't always apparent, and people aren't necessarily forthcoming. So it changes everything. It changes intake for how we work with our clients. It changes questionnaires. Just the way that and look, sometimes we do have to bounce back and forth, and maybe you are seeing certain clients that are on a medical fitness basis, and whereas the other ones you're doing group fit X or something like that, and that's the profession. It can be difficult to fit it all under one umbrella, but this allows us the opportunity to have the education. It's just it just gives us the confidence, if nothing else, to.
And it's not just my program. I mean, I hate to say this. I want you guys to do my program, but all the programs at MedFit have this information, have valuable information based on whatever specialty you're looking for. But this program is a great generalist program because it concisely goes over 30, 35 different chronic conditions. Everything from cardiovascular all the way through orthopedic dysfunctions, as well as, arthritis and cancer and pregnancy and some of the other stuff. And this shouldn't replace the more in-depth programs, but this is a great program for somebody that is kind of looking at, where do I start? Well, this is where you start.
Okay, great. And that was a question actually from the field. Jennifer Ferguson asked, are there any prerequisites for the course?
Yes. And if you ask me what they are right off the top of my head, I know that having a previous NCCA certification,
right.
I want to say, I believe that's one. And we were talking about making a college degree requirement. I don't know if that's been implemented or not.
Yeah, at this point, from what
I should know that, and I apologize for that.
From what I see, this is a secondary type of certification. So you definitely need that initial fitness certification where you're already in the field. This isn't the one that you're.
It doesn't teach you the basic physiology or the nervous system or any of that. This assumes that the person taking this course already knows all that.
Exactly, and it's got to be from a reputable certifying course, and it's a certificate of specialization.
Right.
So that's really what we're looking to do with that. And with that, along the line, insurance is a requirement if you're going to be part of the MedFit network. The MedFit network just came out with a brand new ethics code, which I believe is on their website. And it includes a lot of that information on there. I know the guy who wrote some of that. He's very handsome. No. Yeah, we worked hard on that. In our scope of practice, it's all there. Another question was about CEUs. Yeah, so we apply for the CEUs for these courses. All of your wherever you have your initial certification from, it should be acceptable. If not, sometimes you can submit it on your own. It's a very easy process. You just show them what it is. We're nationally recognized and worldwide, even as a global.
I know right off the bat this is approved by NASM and AFA and ACE.
Right.
It's approved by NESTA. I want to say it's approved by ISSA. And there's somebody else, but I don't remember right off the top of my head. Also, I know it's approved from the Cancer Exercise Training Institute and the Functional Aging Institute as well.
So I had some help from our good friend Lisa Doherty here, NASM, AFA, ISSA, CanFit Pro. The question originally was for Silver Sneakers, Tivity Health. That might be one where you have to submit it on your own. But look, it's well regarded, and it's definitely just something that is so needed as we look at what we're up against. As you said, the government, educational institutes, workplace, medical field. Not everybody is really addressing the issue at hand, which is the numbers that you spoke of, with 18 million with heart disease and 100 million in hypertension.
And people have tried to address it. People have tried to implement licensing for fitness trainers, but the same problem came up. The medical field wanted to run it, the educational institutions wanted to run it, or public government healthcare agencies wanted to run it. And it was a disaster. DC tried it a number of years ago and it bombed completely. Nobody could figure out what to do.
Right.
It's really kind of amazing, which means we have to do it. We have to take the lead on this.
And you're leading the way, along with Lisa and the team here. This is, it's very important to, just the health of our country and our people. And, even if you wanted to put it into an economic standpoint, it's going, we're going to work ourselves into incredible economic debt and just a really bad place. If you want to call it national security and wave the flag on that, go for it. It's a problem. It is a problem. Luckily we have leaders like you in the field that are taking the time to really organize and certify people and become part of this network. One more thing on that, you know, you did mention networking, and I like a massage as much as anybody. Sometimes the best thing you could do is share a link. Your credibility as a certified, you know, somebody who's a specialist in any of our courses can be shown just by a link. The websites are impressive. You know, our website is impressive, and anybody who wants to know what a medical fitness professional is all about will get that information from you sharing this MedFit Education Foundation and the MedFit Classroom and MedFit Network and everything that we do here. So sometimes it's that simple. You know, if we could send them to that and let them know that you're a part of this network, that will get your foot in the doors.
Absolutely.
All right, everybody, we have come up against the end of the hour. Dan, we appreciate it, and thank you very much again.
Thank you for having me, and thank you everyone for listening.